Thank you for coming to this presentation. My name is Dr. Nicholas. I'm the Clinical Research Program Director at North American College of Information Technology. You've come to the right place to learn all about clinical research. Success depends on three things. One is being in the right place at the right time. You've already met that requirement. The second component is to see the opportunity coming. And the third requirement is to seize the opportunity, to grasp the opportunity. If you can do all those three, you will be successful. If you only do one or none of them, the chances are not very good. So you've come to the right place at the right time, and we can get started. The clinical research program is more than a decade old. It has been very successful. It started in 2004-2005, has been delivered at different sites. Today, it's delivered at North American College of Information Technology. The objectives of the Clinical Research Diploma program are to present to you a sufficient body of knowledge and skill sets to allow you to be successful, first of all in the placement and ultimately in your job. You must have a solid foundation in the knowledge aspect and skill sets to be successful. It's no longer good enough to expect to come into the activity of clinical research with a BSc and walk straight in, or with an allied health professional diploma. These are noble, these are very worthwhile diplomas, but the risk is that you will be put in front of a computer to enter data because you won't know how to do anything else. Some sites will train you a little bit and some will not train you at all. You're expected to know this before you can access the job market. Our graduates are very successful, they're very well trained, and they do very well. Hopefully in the program, they move on to good placements and get good jobs as a result. The clinical research program takes 1 year to complete. That includes 9 months of in-class, interactive, contact teaching. I do a lot of the program myself. After the 9 months of theory and learning skill sets, you do 3 months of clinical placement, usually in one of the big teaching hospitals or industry facilities in the Toronto area. The students that come to the clinical research program come from a variety of backgrounds. Approximately 2/3 are made up of internationally educated professionals, mostly healthcare professionals. For example, doctors with MD degrees or MBBS, or dentists with a BDS degree. We sometimes take international graduates with PhDs or master's degrees in various subjects, for example in public health or in genetics. These are all international graduates who will be eligible for the program. They make up 2/3 of our class. The remaining 1/3 is made up of graduates from our Canadian universities here. They come with a BSc, for example, or a Bachelor of Pharmacy, or a Bachelor of Health Science, or a Bachelor of Medical Science. They must have some exposure to health or to the sciences or to biology coming from a Canadian university. Students that come from Canadian universities come, for example, from the University of Toronto at its 3 sites, in Scarborough, the downtown St. George campus, and the Mississauga campus. We also have students that come from the University of Ottawa, from McMaster University, University of Western Ontario, from Windsor, even from UBC. We've had students from Memorial. The demands for clinical research are higher today than they've ever been. Clinical research has advanced enormously. For example, the area of immunology and research into immunology, this only started in the 80s with the AIDS epidemic that started in San Francisco. So most of modern immunology was discovered in the last 30 years. You must be knowledgeable in these areas and you must be skilled. The job positions demand that you be properly trained before you start. Some job sites will provide training for you, others will provide minimal or to no training. They expect you to hit the ground running and to value add to the program. In Canada, we have an aging population, so there are more and more senior citizens, and senior citizens take an awful lot of medication. A lot of research needs to be done into this area, both for the drugs and also for the drug interactions and how they affect our senior citizens. There are basically 2 or 3 different groups in clinical research. You have the seniors, and then you have middle-aged people, and then you have young children, and you have both male and female on both sides. So each one has to be researched in its own right. The role of clinical research placement is to act as a bridge between the classroom, where you've had all the knowledge and skills training, and your final job position. In the placement, you will come to the placement and usually be part of a research team. Your knowledge that you get from North American College of Information Technology will allow you to progress very quickly once you're in the team. You may become a resource person. You'll have other members of your team asking you, how do you do this? How should we do this? How do you fill out an ethics application? How do you go and get informed consent from the participants? You'll know all of this stuff. So you'll be very valuable in the clinical research team. You can assemble a project, you can design projects, you can do all of the statistical design, the statistical analysis and reporting. You're able to do everything. So you become a very valuable team member. If you become valuable and you become a resource person, you will make yourself essential. You will become an essential part of that team. If you become essential, they will not be able to do without you. So you have created your own demand, and the chance of getting a job in that situation is very good. North American College will prepare you for the job because there are a lot of opportunities out there in clinical research. A vast range of opportunities of different skills and of different specialties that are needed. If you are trained in a narrow program that teaches you a few skills in a narrow area of knowledge, you'll only be able to apply for those jobs which you've been trained in. At North American College of Information Technology, we train you for a vast range of opportunities. So if you have a wide range of opportunities, you're allowed to pick and choose because you can do any one of them. This is a huge advantage when looking for a job. This is one of the advantages of coming to a program such as the clinical research program at North American College of Information Technology, because of the vast range of subjects that we cover, and we also cover them in a significant depth. So almost any project in Toronto that you wish to join, you have a very good chance of meeting their requirements because of the quality and the intensity and the range and the depth of the clinical research program at North American College of Information Technology, and that's why we call it the gold standard program.